Hi, Dr. Barker here with Integrative Pain and Wellness Center, and today I'm going to demonstrate some stretches that you can do for jaw pain or for TMJ. I treat a ton of patients that suffer from jaw pain and have been diagnosed with TMJ disorder, and the symptoms can be pain here in the jaw region, into the ear, into the top of the head, the neck. You can have jaw popping, clicking, or locking. Any of those things can relate to problem in the joint here between the lower jaw and the temporal bone. So a few stretches that you can do at home to try to alleviate your pain, I'm going to demonstrate today. So the first one, if you take your finger pads and start up here toward the top of your head and just push and slide your finger pads down the side of your face, keep your jaw slack, so that as you traction down to the bottom of the jaw, it should kind of bring the jaw down. And so you'd want to do about 10 passes. And so really engage these muscles that are from here down to the bottom of the jaw with the finger pads. And it should feel like enough pressure where it feels good, like someone's massaging your jaw muscles. Again, you do that about 10 times. The next one I'm going to show you is take just your your pointer and middle finger pads, and if you start at the corner of your mouth and kind of walk your way back to where your lower and upper jaw meet, and you're going to engage that muscle there, which is the masseter muscle. It's the large jaw muscle that closes the jaw. And so you're going to engage it and put enough pressure where it's going to be a little bit tender, and just hold that pressure there until that muscle starts to relax. Now, it may take anywhere from 30 seconds to 2 minutes of engaging that muscle before that spasm will let go. So just hang with it. Feel that muscle as it starts to let go and become less tender. You know that technique is working. The next one I'm going to show you, if you take your thumb behind the jawline on both sides and you're going to let your jaw just kind of go slack, you're going to be tractioning the jaw forward. Now, often you'll notice that one side is tighter. So on mine, the left side is tighter. So I'm gonna go to kind of the end range of motion on the left side and the end range of motion on my right side. So it's gonna come a little bit further on the right, and you're just gonna hold that pressure steady. It shouldn't be painful. It might be feeling tight. And you're gonna hold that there, and as your body starts to relax, the side that's tighter, so my left side will kind of catch up and become more equal to the right side. So that's when you know that technique is done. That one tends to be anywhere from 20 seconds to a minute and a half for it to fully let go. And then the last one I want to show you is a counter strain technique. So that's where we find a tender point on the body and reposition into a position to relax that. So this technique is best done lying down, but I'm going to demonstrate it sitting. So this spot here on the back of the jawline, if you push in this forward direction with a little bit of pressure, not a ton, very commonly tender in patients with jaw pain. And so check both sides. You can treat both sides, but the treatment, so if I have a tender point on this side, I'd be laying down and I'd slowly rotate my head as far as it'll go to the opposite direction, and then I would retest this spot for tenderness. And the goal is to get the head into a position where that tenderness goes away mostly, so at least 70% pain reduction. And if you've achieved that, then you would just stay in that position for about 2 minutes, maybe a minute and a half, and then slowly come back to kind of the neutral position and recheck. And if both sides are tender, treat both sides. And again, you'll want to do that one laying down. And if you have somebody else that can actually position your head for you, that's even better if you're not using your own muscles to get in and out of the position. So these are some stretches, again, that you can do at home if you're having jaw pain or have TMJ and can't make it into the office for a treatment. But if these techniques, if you're doing these techniques and you're still having pain, then please give our office a phone call. You can check us out online at www.ipawc.com, and our office number is 817-912-1436. Thank you so much. Have a good day.